5 common medications that could wreck your liver. Welcome back to our Healthy Care channel. Today, we're diving into an incredibly important topic that could save your liver and your life. 5 popular drugs that cause liver damage. Many of us reach for these common medications without a second thought, whether to shake off a headache, manage pain, or reduce inflammation. But did you know that even everyday drugs can pose serious risks to your liver if not used cautiously? In this video, we'll uncover the hidden dangers of 5 widely used medications, explore why they can harm your liver, and provide you with crucial tips on how to use them safely. Whether you're taking these drugs currently or just want to stay informed, stick around to ensure you're protecting your liver health effectively. Don't forget to hit the like button if you find today's video informative, and subscribe to our channel for more health insights and tips. Let's jump right into it and start safeguarding our liver today. 1. Amiodarone is commonly prescribed to manage irregular heart rhythms, but it comes with concerns for liver health. Elevated liver function tests, LFTs, are seen in up to half of the patients on long-term amune therapy. While these elevated levels typically do not lead to serious health issues, about 1% of users may experience significant liver damage. In light of these risks, the FDA has issued its highest alert, a boxed warning for Amiodarone, highlighting the potential severe impact on liver health. This warning serves to inform both patients and healthcare providers about the serious risks associated with its use. For those prescribed to done, regular monitoring of liver function is crucial. This entails frequent LFTs to ensure that any necessary adjustments to the treatment can be made promptly. The risk of liver injury is particularly higher in individuals who take the medication at higher doses or over extended periods. Being proactive in monitoring can help manage these risks effectively. 2. Amoxicillin clavulanate. Amoxicillin clavulanate, often known by the brand name Clavulin, is a widely used antibiotic combination prescribed for a variety of bacterial infections, including pneumonia, urinary tract infections, and sinusitis. Have you ever been prescribed this medication? Share your experiences in the comments below. Surprisingly, after paracetamol, amoxicillin clavulanate ranks as one of the top medications associated with liver damage. This combination pairs an antibiotic with a substance designed to inhibit bacterial resistance, enhancing its effectiveness. However, it's believed to potentially cause liver damage through an allergic reaction. Although the exact mechanism is not fully understood, it's important to be aware that other drugs frequently linked to liver injury include antibiotics such as IIS, trimethoprim, Sulome, Oxazole, Aramacin, nitrofurantoin, minocycline, and the antifungal medication ketoconazole. If you are taking amoxicillin clavulanate or any similar medications, regular monitoring of liver function by a healthcare provider is advised to catch any potential liver damage early. 3. Diclofenac. Diclofenac, marketed under names like Cataflam, is a non-steroidal anti-inflammatory drug and said widely used to alleviate pain from various conditions, including arthritis. While effective, its use raises concerns, particularly when taken orally as opposed to its topical forms like gels, creams, and patches, which pose a lower risk of liver injury due to lesser absorption into the body. For those using oral diclofenac, the risk of severe liver injury increases with chronic daily use, especially in individuals predisposed to liver complications. As with many NIDs, diclofenac can cause liver damage that might not immediately manifest symptoms, but can lead to significant abnormalities in liver function tests. LFTs. These tests measure liver enzymes, and elevated levels can indicate liver injury. Monitoring through blood tests conducted by healthcare professionals is crucial to detecting these signs early. Although serious liver damage from diclofenac is rare, the risk is heightened in certain populations, particularly women, those on higher dosages in extended use, typically beyond 4 weeks. 4. Tylenol. Tylenol, a common over-the-counter medication, contains acetaminophen, a pain reliever and fever reducer that is generally safe for the liver when used appropriately and within recommended doses. However, it's important to recognize that liver damage can occur if Tylenol is taken in large doses or used chronically. A single excessive dose of Tylenol can lead to acute liver damage, a serious condition known as Tylenol overdose, which requires immediate medical attention. If you suspect an overdose, it's critical to contact a poison control center or seek emergency medical care without delay. Frequent use of Tylenol or taking it over an extended period increases the risk of liver damage, especially in individuals with pre-existing liver conditions, chronic illnesses, or alcohol use disorders. To reduce the risk of liver issues related to Tylenol, consider the following precautions. Never exceed the maximum recommended daily dosage of 0.0 mg. Avoid alcohol consumption while taking Tylenol. Check if acetaminophen is an ingredient in other medications you're taking, including over-the-counter and prescription pain relievers, to prevent unintentional multiple dosages. Common cold and flu remedies often contain acetaminophen as well. Acetaminophen can harm the liver by producing a toxic byproduct during its metabolism. This metabolite can accumulate over time, leading to structural changes in the liver and impairing its normal function. Drug-induced hepatitis A condition where the liver becomes inflamed due to the effects of medications often results from excessive or inappropriate use of medications known to be harsh on the liver, such as acetaminophen or nalide. Other pain relievers, including Advil, ibuprofen, Volin, diclofenac, and Sindac, are also associated with liver injury. It's an ironic reality that the medications we rely on to alleviate pain and discomfort can pose such significant risks to our liver health. The liver plays a crucial role in metabolizing medications, neutralizing them to prevent accumulation in the body, which could potentially cause harm. However, this protective mechanism can paradoxically endanger the liver by producing toxic compounds in the process. Being aware of these risks and taking steps to use medications like Tylenol safely can help maintain their liver health and overall well-being. 5. Statins. Statins are among the most widely prescribed medications, globally renowned for their effectiveness in managing high cholesterol. Commonly known brands include Simvastatin, Zocor, Adur, Vastatin, Lipitor, and Rosuvastatin. While statins are essential for many to control cholesterol levels, they do come with a potential risk of liver injury. The damage caused by statins is thought to result from either a toxic metabolite produced during their breakdown or an allergic reaction, although the precise mechanisms remain unclear. Instances of liver injury from statins like Simvastatin are generally mild and often reversible once the medication is discontinued under a healthcare provider's guidance. In many cases, patients may continue using the medication if the liver damage is not severe. However, in the event of a significant increase in liver enzymes, it might be necessary to switch to a different statin. Although liver issues related to statins are rare, they can occur, which is why health care providers often perform a liver enzyme test before starting the medication and shortly thereafter. Continuous monitoring is typically not required unless symptoms that may indicate liver damage appear. These symptoms include unusual fatigue, weakness, loss of appetite, upper stomach pain, dark urine, or yellowing of the skin or eyes. If you experience any of these symptoms while taking statins, it's crucial to contact your healthcare professional immediately. They can provide guidance on whether it's safe to continue the medication or if adjustments are necessary. Being proactive about monitoring can help balance the benefits of statin with the need to protect your liver health. Can supplement cause liver damage? Dietary supplements can indeed cause liver damage. Remarkably, studies have shown that supplements account for up to 20% of liver injury cases in the United States. This statistic underscores the importance of cautious use and understanding of the potential risks associated with dietary supplements. Supplements linked to liver damage. Bodybuilding supplements. Products containing anabolic steroids are particularly notorious for causing liver damage due to their potent and often harmful effects on liver function. Weight loss supplements, those containing green tea extract, have been implicated in several cases of liver injury despite the health benefits often associated with green tea. Hios Vitam in certain vitamins like niacin can cause liver damage when consumed in excessively high doses, particularly dosages reaching 3.0 mg per day over several months. Herbal products, supplements like Gynin and Black Cash have also been reported to cause liver issues, highlighting that natural does not always mean safe. ingredient nutritional products, these can contain a mix of substances that might interact poorly or overload the liver. Given the potential risks, it is crucial to approach the use of dietary supplements with caution before starting any new supplement regimen, especially those involving high doses or long-term use. Consulting with health care professionals is essential. This step is vital to ensure that the supplements will not adversely affect your health or interact negatively with other medications you may be taking. Early signs of liver damage from supplements. The liver is a resilient organ capable of withstanding many forms of injury. However, when it is damaged by medications or supplements, it can deteriorate rapidly and fail within days. Recognizing the early signs of liver damage is critical and can include symptoms such as fatigue, weakness, loss of appetite, upper stomach pain, dark urine, or jaundice, yellowing of the skin or eyes. If you experience any of these symptoms while taking supplements, it is crucial to cease use immediately and consult a healthcare provider for an evaluation. Early detection and treatment are key to preventing more severe liver damage or failure. Liver damage from medications is a serious health issue that can escalate rapidly, sometimes with life-threatening consequences. It's essential to be aware of the symptoms and factors that contribute to drug-induced liver injury to ensure timely intervention and treatment. The progression of symptoms related to liver damage can vary but often includes early signs, nausea, vomiting, and mild abdominal pain. Progressive symptoms, severe abdominal pain, fever, diarrhea, dark urine, and jaundice, the yellowing of the skin and eyes, which indicates high bilirubin levels in the blood. Advanced stages, extreme fatigue, sleepiness, skin rashes, and pale or white-colored stools. In severe cases, symptoms may escalate to coma. If you experience any of these symptoms, it is critical to seek immediate medical attention. Bringing any medication boxes or lists of recently used drugs to your health care provider can be incredibly helpful in diagnosing and treating potential liver issues. The liver plays a crucial role in metabolizing and inactivating drug, a process that is generally consistent across individuals. However, variations exist due to genetic differences, which can explain why some people are more sensitive to certain medications. These variations can lead to the liver producing toxic molecules as it attempts to process certain drugs. Additionally, some medications can trigger severe immune reactions that lead to liver damage. This scores the importance of monitoring for any signs of liver injury, especially when taking medications known to potentially affect liver health. While this discussion highlights 5 particular medications known to cause liver damage, it is important to understand that other drugs may carry similar risks. To determine if the medications you are taking might pose a risk, consult the adverse effects section of the drug's leaflet. However, do not panic upon finding risks listed. Instead, maintain an open dialogue with your healthcare provider to address any medication-related concerns. Drug-induced liver injury, while serious, is relatively rare in the general population. Being informed and vigilant about the medications you take and their potential impact on your liver is crucial for maintaining good health. If you found this information helpful, please give it a thumbs up and consider sharing it with your loved ones. For more insights on health and lifestyle, subscribe to our channel and hit the notification bell to stay updated with our latest content. Stay informed and proactive about your health.